UFTV is your university and community TV station.
So thank you for coming, and we are super excited to have everybody here for the 16th Annual Evening with a Leader. The faculty and I look forward to this event every year, and there is a significant amount of planning that goes into this event. But we are really happy that we're still able to provide this, especially to local practitioners, to provide the CEU event at no cost to you. A couple housekeeping items just to, make sure you turn your cell phone off. I did mine right before I came up here, because you know how you forget. So turn your cell phones off. If you have to leave for any reason, if you guys could use the back doors, we would appreciate that. There are restrooms located all through the AMU, and I see that we're actually opening doors so that you'll be able to get back in. So that's a good thing. So you'll be able to get back in if you use the back doors. Before we get started, I would like to take a minute and to acknowledge some people that are in the audience tonight. So the first group of people is the two administrative assistants that we have, Amy Yater and Kathy Hawkinson. If we didn't have them, we could not do this event. So when you pass by and you see them, if you could say thank you, we would greatly appreciate it, because they are totally the meat and potatoes of this event. The event continues to get bigger and bigger and bigger, so much so that we have formed a committee to make sure everything happens. So Lisa Sake-Miller, Becky Hare, and Hare and Miranda Tippie are part of that committee, and they ensure that we have great speakers and that the speakers get here and all the good stuff. So we appreciate them. The other group of people that I really would like to acknowledge is the faculty at the University of Findlay, if they would stand up. My faculty, part-time, full-time, and lab assistants, without them, and their total entertainment for me on a daily basis, we couldn't do what we do here. And there are many students and alums sitting in this audience that these people have been a big part of your life, and we are so happy that they're here. Another group, if you are an alumni of the University of Findlay, please stand up. Woo, look at that. We are so glad you're here. Welcome back, welcome home, and actually there are a few people in the audience that actually just passed their CERT exam like in the last week, so we're super happy for that too. The other great group of people that I would like to acknowledge are totally our current students, so if you're a current student, please stand up. There you go. We spend a lot of time with these people. We spend a lot of time, and so we're super happy that they're here tonight as well. One last group are our fieldwork educators. If you've ever taken a student from the University of Findlay and you're one of our fieldwork educators, please stand up. And I know you're out there because I've talked to some of you. There we go. There we go. You are an extension of us, and if you didn't do what you do, we couldn't do what we do. So we totally appreciate the work that you do for our fieldwork students. And if anybody wants to become a fieldwork educator, Heather Colt would be who you need to talk to. She will be here at the end of the presentation, and she would love to chat with you, okay? So, I always get a plug for those fieldwork educators. So this evening,
everybody that's going to be a fieldwork educator stand up. So.
And then everybody would stand up, right?
That's right.
That's right, everybody would stand up. So again, this evening we are excited to be able to utilize our resources and provide this evening at no cost, and to bring another. This, I think you're our 5th AOTA president to come.
Probably.
Another AOTA president to Northwest Ohio. So I'm going to let Lisa Sake-Miller introduce our speaker.
Thank you. Can you guys hear me okay? I'll squat down. Okay. Dr. Wendy Hildenbrand is president of AOTA and a clinical assistant professor in the Occupational Therapy Education Department at the University of Kansas Medical Center. She earned a Bachelor of Science in Occupational Therapy in 1989, a Master of Public Health in 2002, and a Doctor of Philosophy in Public Administration in 2016, all from the University of Kansas. Dr. Hildenbrand's practice experience includes work in mental health settings for more than a decade, school-based practice, and population and community health contexts. Her professional expertise includes leadership development, professional formation, policy development, and implementation, advocacy, public health, and building bridges between policy and practice. Her most recent research examines the experience of role conflict in frontline occupational therapy professionals when implementing policies such as productivity requirements and working to maintain professional values such as client-centered care. Dr. Hildenbrand's title for her presentation this evening is Rise Above, Role Conflict at the Intersection of Policy and Frontline Practice. Let's give a warm welcome to Dr. Wendy Hildenbrand.
Now, because we were having a mic issue out there, they put this on my chest. Does that work? Okay, well then there we go. Why do you have a familiar face to me?
Me?
I believe it's because we met in Michigan.
We did. We met at FAOTA, and I met you at the Conference for Mental Health and Opioid.
That's absolutely right. And you talked to me? Yes, indeed. That's right. I know. I'm like, I know that face. So it's good to see you again. So, oh my, wow. How nice to see a big room on a snowy Thursday. I did have the opportunity to fly in yesterday, and I'm very happy that I did, although it took me a minute getting out of my own hometown of Kansas City as well. So I'm excited to be here. Who knew I'd be in Findlay, Ohio, right? And here I am. But already since I've been here, I've met wonderful people. I've had wonderful conversations. I'm excited by your faculty and the cool stuff that they're doing. And I'm excited for all of you when I talk to your students and know that they're going to be out there like lighting it up here shortly, right? Who are the practitioners in the room? Where are you? You know, that's a stand up too. Yeah, everybody stood up. Where's the practitioners? I want to see you stand. Okay. Well, I just had to check in on you. You've probably been working hard all day, so I know you'd rather not stand. But I appreciate you doing that because I wanted to know where you are too. Every person in this room is a contributor to our occupational therapy profession, to our community. And so I just wanted to make sure that I had a good set of eyes on all of you. I'm watching you, right? Okay. We're going to go ahead and get started. I know we have until 8:30 in this room. I also, I believe that we are probably, is there like a thing? Is that me or someone else? Okay, I was like, I didn't know I was squeaking tonight, but I just wanted to make sure. I know we have until 8:30, but I think you might have some questions of me perhaps. And so I'm going to do what I can to leave a window of time at the back end and see if you've got something that you want to chat with me about, bring to the group. I'd be open to that. I'll see if I can whiz through this so that we make room for that time. You got the title of this, right? I mean, obviously from the introduction, you can tell that some of this is going to be also information that came from work that I did when I was working on my doctorate degree in public administration. I'll get to why that was interesting to me as we go through. But it's also, the first two words are rise above, okay? And I'm using those words to frame this because that's my challenge to you as we talk about just this point in time in our profession, as we talk a little bit about challenges that we all face, about opportunities that we have in front of us, and really think about that space where conflict can sometimes happen, where we can get conflicted between our roles and responsibilities and the things we know are right, but not always easy to do. And yet we have to make hard decisions to be the best ethical practitioners that we can be, right? And so that's why I frame it that way, because we all have that opportunity to rise above And I'm going to go a little further and say we have that responsibility to do the same. Okay, so, I'm moving it on mine. Hold on here. We have dueling computers. So one to keep me on track and one to keep you guys with me. So let's see if this will go. Hold on. It might be on the side.
Wait, stop clicking.
I've caused problems here.
Here I go.
Okay, so far so good. All right. Again, just a thank you for letting me be here. This is a generous opportunity, and I welcome the chance to be with you and share a little bit about things that kind of I think about. I also bring you greetings. Had to do it. Gosh, didn't I? I am a Kansas City girl. Yes, indeed. So I don't know if you watched the Super Bowl or not, but I did, and I'm still very excited about that. So I'm bringing a victory picture here to share with you. I also bring you greetings from my home. I'm at the University of Kansas in Kansas City, and it's Jayhawk country. They usually behave better than they have recently, so I'm hoping that they get themselves in check. But I do teach at the University of Kansas Medical Center in the Occupational Therapy program there. And then I also bring you greetings most recently from the AOTA Board of Directors. I was just there for meetings last week, and so this is the most recent picture of me standing with hardworking occupational therapy professionals, OTs and OTAs in that mix, as well as staff, trying to do our best to serve you. So, but the best picture by far, Patrick. Okay. I am wanting to just kind of outline like today and tomorrow a little bit. I asked, what did I need to be prepared to bring to you all? And basically it was like, something that keeps me thinking, something that keeps my mind buzzing was something that I need to share with you, something that excites me about the profession. And also, if I can swing it, something that'll respond to the licensing board ethical requirements or ethics requirements that you guys have. I don't know if it'll do it or not, but we're going to try. This was kind of my task. And so tonight, I'm going to share with you just things that keep my mind buzzing about our profession a bit. And then tomorrow morning, when we talk about population health, that is something that excites me for our profession. And so that's what we'll be doing tomorrow morning if you are able to join us then. Okay? So, a few things. We're going to kind of talk for a short minute about some current known and unknown practice change drivers in our professional environment. I'm going to share with you a little bit about the research that I did looking at role conflict on the front lines of practice. It's a hard place we practice. There's a lot of expectations, a lot of demands, and it was concerning enough to me and interesting enough to me that I spent many years working to understand that. And so I want to bring that to you all, in a bite-sized piece here in just a bit. We're also going to be talking for a minute about clinical resilience and well-being as a priority focus for our AOTA Board of Directors. It's something that matters hugely to me and is something that I think is critical for us if we're going to be a sustainable, sound mind profession. And I think we owe that to the people we serve as well as ourselves. And then maybe a short few minutes there considering strategies to support clinician well-being and positive practice. Were any of you in New Orleans? Yeah, if you heard a little something from my address, you know that that's kind of where my head lies, is in things positive and forward focused and trying to help us all get on the same page in a good way. So I hope you hear that message tonight too. But on that happy note, we're going to start first with change and challenges, okay? Our current situation. We are in the middle of change and challenge, right? We have things that we know, and we have things that are kind of unknown about what's happening in our environment. I don't know about you all, but you go to work every day, right? You love what you do. You love your profession. You love occupational therapy. And I'll be darned, if it wasn't that you didn't love your profession so much, you would not do that every day, would you? You would not put yourself in positions where you had to think that hard. You would not put yourself in positions where you had to second guess yourself or other people. You wouldn't put yourself in a position where it was that challenging sometimes, right? But we all put ourselves in those positions because we know that it's the right thing. It's the good thing. And it's what we are able to do in that work that we find reward. So the known, though, even knowing that we love our profession, we also know that there's change afoot. There's challenges going on in our profession, right? In our day-to-day. Things that are associated with our profession as a whole, things that are about policy, and things that are about practice. There are questions in our profession about education, right? Our entry-level practice is decided. What's the way to come into the profession? That's been decided. It's been decided a few times, right? The decision is that we have dual points of entry into our profession, whether it's at the occupational therapy assistant level or the occupational therapist level. With that, it's an awful lot of opportunity. With that are also little bits of challenge, sometimes little bits of disagreement. And that becomes a known conversation, a known challenge that we have to contend with that sometimes becomes kind of tricky when we think about our profession. Things like demographics, changing demographics. Our profession does not look the same right now as it's looked like forever and ever. We do have a changing demographic in our society. And so we're starting to see differences in our profession. It's a thing called diversity. It's a beautiful thing, right? We're getting different viewpoints. People are entering our profession with different life experiences. People are coming into our profession with different expectations of educators, of fieldwork experiences, of you as practitioners. So we have an awful lot of things out there that are changing, in part because as a society, we've got some shifts going on, okay? Within our profession, we have shifts going on. I was just with this group of faculty today. What was that word, faders? When people start thinking about retiring, we have a whole tier of people that are starting to enter what I would call the afternoon of your life. I like afternoon. It's my favorite time of day, right? And they're entering that afternoon of life. And they might be faculty. They might be practitioners out there, the people in the management office, the management, end of your facility. And they are people that are starting to have second, plans. What's my next life going to look like? And so that shifts things, and it shifts that responsibility. All of a sudden, there's a handoff to somebody else, to take the reins, to take that leadership, and to be the people that show us the way. And so those changing demographics, that's a known, okay? That's something we know is happening, it's something we know is coming. But it is something that kind of challenges us a bit, it presses us. Policy. Have you guys noticed policy change? Wrecking havoc a bit lately. Lots of havoc, lots of uncertainty, lots of questions. Unfortunately, enough people that have had a change in their job or in their next step goals. It's very unsettling, right, for a lot of people. I'm talking specifically about things in our skilled nursing environments, and most recently also flipped that switch on home health, right, on January 1. That's policy stuff happening up here, right? And it's trickling down through an awful lot of avenues to get to the front line, and that place in the middle we've got some challenges there to contend with as far as interpretation, as far as how agencies and companies are making decisions, things like that. It's a known problem. Part of it's known because we're hearing from you. We AOTA, we the folks at AOTA are hearing from you about difficult experiences that you've had. And I say difficult, for somebody in here, difficult doesn't even touch it, right? I mean, I know that. But we are also, using those experiences to take that, provide stories, provide information, provide a reality check for CMS when they're asking about, how's this working in your profession? The answer is not so good. All right, and we need to have more conversation so we can continue to stabilize that marketplace. That doesn't mean that it's going to turn around and go back like it was on December 31st or on September 30th. Okay? Change is not necessarily a bad thing, even change in those marketplaces. But if things are arbitrarily being done in a way that's not grounded in the actual parameters of the policy, or done in a way that's not transparent for folks so they can at least understand it, then we do have some problems. Practice, there's shifts happening in practice, okay? Whether it's about payment, whether it's about where we practice, whether it's about the models of practice, all of those things are things that are known changes, things that are shifting up, okay? Some of the particulars we don't know. That's part of change, right? We don't have it all lined out. We don't have everything tackled to have it just so. But those changes are happening. These are things that we know, okay? The now part of this then, just kind of to circle back around on that policy thing, now, based on what we know, right, we have concerns. AOTA and APTA sounding off about the PDGM and PDPM kinds of therapy impacts, the consequences there for people that we serve and for us as professionals, okay? There's a lot of focus on how this is affecting the occupational therapist and the occupational therapy assistant. The bigger issue and the bigger argument that you'll be able to make, probably in a way that helps people understand the full scope of this, is when we talk about the impact it has on access to services for people that we are working with every day. When you're in a home health environment and they've changed those things up, and all of a sudden physical therapy is seeing the people for 6 visits, and we're not getting the visits that we should be having per an evaluation, that's a problem, right? But we've got limited parameters that are at play right now. Trying to strike that balance with people has been very challenging, all right? This came out from CMS earlier in the week. The need for therapy services under PDGM remains unchanged. This is the home health situation, right? And you guys you're with me on the PDPMs and PDGMs, right? Patient-driven grouping models, patient-driven payment models. The need for therapy services under PDGM remains unchanged, okay? Therapy provision should be determined by the individual needs of the patient without restriction or limitation on the types of disciplines provided or the frequency or duration of visits. This is happening. And so it became, necessary, not that we didn't see that one coming either, necessary for us to be having intense, frequent conversations with the people at CMS about the changes that are happening, and be able to let them know that there are some situations there where limitations are being imposed as it relates to disciplines or frequency or duration of visits. So this is a thing that's out there. It's also something that we are working to address and deal with these known and unknown challenges. The unknown then, we've got all kinds of unknown going on out there too, right? That doesn't have to be a bad thing either, but they are unknown. Which direction to go on some of these things, not always clear. And also, what's going to be down that road once you go is not always real certain either. And so, I just share this with you because this kind of, in my mind, represents where we are on a number of things. just out there in society as a whole, but then that, trickles into or, makes its way into things we have to entertain for our profession. So the unknown professional changes and shifts are largely connected with technological things going on out there, technological changes, economic changes, okay, demographic changes that I talked about, and many other things too. Drivers of change are the things that I'm kind of talking about. Some of these things being identified through ASA, it's the Society for Association Executives, the Association for Association Executives. And they are doing an awful lot of looking at what are the drivers of change these days that are impacting associations. AOTA is an association, and then by extension, we have a very similar conversation when we talk about our profession, right? And I put this up there because what was on the page before, right? The unknown professional changes and shifts. And so I just want to share these drivers of change with you because these are some of the things that are a little unknown right now, but they're whirling all around us. And they make us have to think about how we do business. How many of you have put a search in your phone and then, within 2 minutes, you had an advertisement in your Facebook and your Google and your everything else, right? People are paying too much attention to you. That's what's going on. Or it's this algorithmic kind of thing that is all up in our places. It's all in our business. That's making a difference out there in the way we are gathering information and how we are interacting in our environment. American inequality, that's a driver of change right now. Lots of conversation going on. This isn't a new driver of change, but it certainly is something that's on the forefront of a lot of people's mind. Declining trust. How many of you are second guessing the people around you? How does that help you to maintain a positive work environment? Oh, not those people, they're okay, right? I saw you checking them out there, like, should I be worried about you? But we have this trust thing going on in our society, and a lot of that mirrors what's going on in some of our workplaces right now, or in some of our relationships with colleagues. And so, that's an issue as well. Ethical consumption, let me see. Anybody have an idea what that means? Some of you, this is about you. And I'm talking about a generation that is very committed to social change, very committed to fairness, very committed to, are we taking care of our world for people behind us? Talking about a younger generation that's about what's the socially just thing to be having happen here. And they're making decisions based on that. The ethical edge of innovation. We keep pushing, don't we? Innovation is a thing. It's happening out there. Lots of cool ideas, lots of things we can't do. Doesn't always mean we should do. That becomes a conversation, but also becomes a driver of change. Healthcare disruption. That's a happening, isn't it? Healthcare disruption now in the policy kind of things that we were just talking about, but also healthcare disruption as it applies to changing marketplaces and changing delivery systems. Have you all been at an urgent care in your area pharmacy lately? That's a healthcare disruption thing, right? Amazon in the marketplace, Walmart in the marketplace, right? A lot of people that are in the mix on healthcare right now, okay? They're not going away. They're not going away. And we can look at that and we can get, kind of freaked out about it, or we can look at that and say, where's occupational therapy in that mix? Where's our opportunity to be part of a disrupted healthcare system? It's only disrupted because it's not what we're used to. It's only disrupted because there might be some things we're still trying to figure out, okay? Disruptive does not have to mean a bad thing, difficult thing, or something that's going to be like the end of the world, okay? Inclusion and diversity, these are drivers of change. Right? We can't make plans, we can't make change happen, we can't move forward unless we've got something about inclusion that's just like central to our conversation, central to how we do business these days, okay? Now, I'll leave it up to you to think if that's a new thing, an overdue thing, whatever that is in your own, way of understanding. I'd have to say that I'm excited it's there. I'm excited enough that it's there, that it's a priority for our 2020 Board of Directors at AOTA. Population health, there's a change. Drivers of change, okay? Population health is a conversation all over the place, whether it's about the Institution for Healthcare Improvement or the Institute for Healthcare Improvement, whether it's, going back to the triple aim, where population health, all of a sudden had a big push and a big buzz, right? This is where people are spending an awful lot of time, an awful lot of energy as to how can we make a bigger impact in health, okay? And that's one way to have that happen. Shifting terrain for advocacy. How many of you belong to your state association? Me too, okay? If you have a minute to circle back around and renew, because I know that's the only reason, right, that you wouldn't be a current member, would be it slipped your mind. It'd be a good thing to do, because as advocacy changes, the stuff that's happening at the federal level, okay, there's always going to be advocacy needs at that federal level, but as people are starting, just even more and more to try to push things down, and I mean like down the road, like kicking the can, like putting it in the hands of states to implement policy, to allocate funding, things like that. I mean, that changes who you have to be talking to, okay? So that's a big change there, a big advocacy change, okay? Splintered society, and it's hard for people to connect. I mean, that's a driver of change. How do we create community? How do we help people connect with one another? How do we help people see that occupation, that community as critical to health and well-being? How can we be a part of that? And then transparent organizational ethics. That's kind of the last one on there that I'd like for you to take a moment to think about. We've got a lot of organizations out there that some people have questions about how they're doing business. It'd be nice to know what's going on in some of those places. It'd be nice to ask questions. It'd be nice to be a part of the process. And so, as these things continue to be on the mind of everyday citizens, everyday consumers, and in our own profession, it's worth thinking about how we can also embrace those as opportunities and how we can prepare for that intersection between what's happening in these drivers of change kind of places, okay? The ethical edge of innovation, we have questions about that in our own profession. When I get a question about, from folks that say, so is population health really occupational therapy? There's an interesting question, isn't it? Is that because that's an innovative thought? All it means is we haven't thought about it enough before, right? Okay? It's not an ethical question. But if it's something that we need to sort through those things so that people can feel comfortable in understanding that and recognize that that's particularly within our bounds and our scope of practice, and that's a good thing for us to pay attention to, right? Inclusion and diversity, we have to do that. We can't be that closed in our own entry into our profession and then try really hard to connect with a society out there that looks a lot different than a lot of us in this room, okay? We have to do some work in all of these areas, okay? All of that might be conflicting, right? Might make you a little bit conflicted about, the stability of our profession or where we're going. How many of you have that job that you've had for the last 10 years? Don't want to go anywhere, right? Maybe you do. Maybe it's time, right? Change is going to happen. Change is going to happen, and it might push some of us out of our comfort zone a little bit. For those of you, though, that are just getting started, you don't have a comfort zone yet, do you? And when I say comfort zone, I kind of mean like rut. Is that true? Are you ready to take on the world? I would hope so. I share those things with you, though, because that's kind of that where we are now thing. What I want to shift to is to talk with you guys a little bit about just the overall challenges that I've seen on Frontlines, on practice, and how that has contributed to role conflict over time in our profession. The things that I was showing you are things that are kind of like future type, right? Like right now, and things that are going to continue to build and cause problems or create opportunities for us. What I want to shift gears, though, and talk to you guys about now is about our practice and also about role conflict and how we are able to think about moving forward and dealing with things like productivity issues, being sure that we're committed to our professional values and our ethics, and standing firm in the places where we need to be, okay? When I was doing my dissertation, I did a study, one study, examining the intersection of policy and practice, okay? It was much more aligned with things that we're comfortable talking about, because unfortunately it was focused on things that we've all probably got some experience with over the last several years. And that's a thing called issues with productivity requirements. Okay? Anybody in here had that kind of an issue before? Productivity requirements, they're no fun, right? So, I'm talking to you then about the study that I did where I looked at the intersection of policy and practice, policy being productivity expectations, and the practice issue being client-centered care. All right? It was one that came to me as I was listening to my students, as I was talking to frontline practitioners, and as I was trying to pay attention outside to the professional landscape. And I don't know, but I don't know that there's always a whole lot of people that are taking interest enough to like study this thing. I mean, we know it's happening, right? We know that there's issues in productivity, and we know that presses people. But I hadn't come across a whole lot of things where people actually studied what was going on out there and tried to get past some of the anecdotal stuff. So I looked at the intersection of those two places. I was concerned about my students. I'm concerned about students in this room. I'll share with you the quote that really tipped that for me here in just a minute. But I was concerned about my frontline practitioners. And I say mine because the Kansas OT Association, those are my people. I mean, that's where I grew up, you know, as an occupational therapist, was in Kansas. And so when I'd be at a state conference or other places where we're talking, and they're talking about the stress and the press that they were feeling, that was troublesome to me. So I was like, I need to know more about this. And then as a profession, we certainly could feel and hear the outcry from people saying, what is going on with this productivity expectation? How is that humanly possible? How is that ethically right? How is there any way that that's best practice for people that we serve? Okay? And so because of that, I got interested in looking at role conflict at the front lines of practice. We work in complex places, right? I mean, we have competing agendas, competing values, and we have protocol-driven, you know, therapy tracks that some people then try to call client-centered therapy tracks, which is not always necessarily the case, right? Efficiency and effectiveness sometimes can be at odds. Effectiveness is about getting the job done right? Efficiency is about getting it done with a good handle on resources, fewer resources, you know, less time, less money. How can we be cost efficient when maybe we need to do things differently? These complexities, you know, decision making, There's a tough time sometimes when people have to make decisions and they've got facts, but then it runs square into the crosshairs of values, right? And that makes decisions hard. Implementation, that's another complex thing in institutions. Right now we're having problems because of the implementation thing happening from CMS up here to the front line, and the implementation kinds of strategies that are having to take place in there. Rules, trade-offs, all those kinds of things. Policy, that's another complex piece of our institutional kinds of environments there. It's full of policymakers, it's full of management, and it's full of professionals like us, and they don't always line up well. And then we've got, professional complexities, right? Professional pressures out there and professional ideals. I mean, every person in this room, I have no doubt, has the intent every day when they go to work to do their best for the people they serve, whether that's, clients in your program, at your institution, whether it's students in your program. I mean, you assume best intent, right? But it's hard. Professional pressure to do more with less, to do more and do it this way. People telling you how that's going to be, that's how we do it here thing, that's how we've always done it. You might have run into some of that. Profit, there's some pressure. Might be part of what's playing into some of what we're seeing out there right now, okay? And then productivity expectations definitely adds to the pressure, okay? And all of that's happening while we're trying to do our best, our professional best here, being authentic practitioners, guiding our decisions with the best evidence that's available to us, and when short on that, with the best grounded clinical reasoning that we can use, right? Occupation-based interventions, quality therapy, that's the complex place where we live. Okay, I told you about that student, right? That kind of tripped my trigger on this. This was what she said. And she came back all excited from field work, except for the part where she was very distressed coming back from field work. And what she asked, she's in my doorway, Wendy, I need to talk to you. Okay, let's talk. And this is what she had to say. I'm not sure what happens to us when we go out there. They're in our program. We're doing all the work. We're learning how to do this occupational therapy thing. We've got all those professional ideals in our head. We're sharing those with our students. We're sharing those through continuing education. And she says, I'm not sure what happens to us when we go out there. But I know I spent 2 months of my field work doing what was expected of me instead of what I knew I should be doing. Then I figured I was only there for another month, so why not try something new and see what would happen? I had to do something. She had to do something, right? I knew I wasn't comfortable with what we were doing, but I didn't want to rock the boat, okay? And when we were having that conversation, this is one of those students. How many students are in the room? Every one of you are the students, so no, I'm talking to each one of you. But you have those students that they're going to go out there and they are going to knock it out. You have high expectations for them. They have high expectations of themselves. And then they come back to your doorway and they say, what happens to us out there? And what happens is that complexity thing. All those presses, that institutional stuff going on. Their own professional trying to figure it out thing going on. And needing to be able to land in the right place with that. But when we had that conversation, I thanked her when she left, because I told her, I said, I think you just squared up my dissertation. And so thanks for coming by today. And so I also talked with my Kansas people, okay? Stories from the front line. We had a round table at one of our, conferences. What's pressuring you? And these are some of the things that they shared with me, okay? They talked about, on all fronts, being in positions where they were wearing too many hats. And that led to personal and professional conflict. They had too many things going on. They couldn't do it all, in spite of all their best efforts to do that. They talked about feeling not understood. That age-old, I'm still trying to, help people understand what occupational therapy is all about, right? And so they were feeling they were having to work really hard at that. And then that tussle between person-centered and protocol-driven practice. That was a problem in much of the discussion that we had. Not because person-centered was winning out, but because protocol-driven was ruling the progress or the process that they were having to do at the place where they worked. Some of my friends in our medical facilities talked about, no hesitation, loud productivity and documentation requirements, challenging their ability to focus on what's best for the people that they were serving. Got in the way of them being able to do the things that they felt were going to be of most service to them. And then my friends in my school system, folks out there, they were really struggling with the competing service delivery models, ideologies, and expectations. And I captured that. That was what they were talking to me about with that was inclusion, right? Wanting to be fully inclusive, but then hearing from their administrators that that's not what they could do, okay? Wanting to try to be on a bigger scale, health promotion kind of efforts in their school districts, or being able to work with the kids on social skills in a bigger way, in a more broad kind of reach way, only to be told that that was not what occupational therapy did here, okay? So these were the things that they were talking about and things that caused them a good deal of conflict. And then at that same time when I was doing this, we were also hearing from practitioners at AOTA. And people were calling, and people were coming to town halls, and people were letting us know that productivity is the problem I need you to pay attention to, okay? This is causing me stress. This is challenging my capacity to be the best therapist I can be. And I don't like it. What are we going to do? What's getting in the way? How can we do something different? Is there a statement? All of those things. So I put these up here. Now, this was back in 2014, in the height of a lot of that. It hasn't gone away. It hasn't gone away at all, okay? So it's an ongoing effort. It's a continuing effort for us to be working with not only our, discipline partners, APTA, ASHA, and be a strong group together, but to continue to provide counsel and direction for people at the agencies that make those decisions. The other part of that too, though, is we need to continue to have conversations with our occupational therapy professionals about that challenge of when you're in a place where it's not a fit for you, sometimes you have to think about another fit. And that's a hard thing for people to do sometimes, particularly if they're particularly in their mind stuck there, attached there, married to it. Whether it's about, I don't want to change jobs, whether it's about, but the salary's paying for my loans, whatever is the thing. Those are decisions you have to grapple with yourself and make a good call for your own health and well-being, and also good ethical decisions, okay? It's always one of I find it to be an interesting question that people ask sometimes. But if they're not doing things right here, what do I do? It's kind of like the question about, this volume to value-based care. In that situation, they're asking you to do quality care. I'm not sure I understand what's wrong with that, right? When people are asking about, they're doing unethical stuff where I'm at, what do I do? Is it a question? What is the question? Make sure you really have a question. What do I do is not the question, okay? It's thinking more specifically about, are you going to be a part of the solution there? Are you going to continue to do things where you walk into somebody's office and say, what happened to me? That kind of stuff. What are you going to do in those situations? It's a hard spot, but one where you have to start sorting through how you address some of those issues. I had to look at literature, as you can imagine, and I had to think about how to move forward. So one of the places where I felt like I maybe could contribute was in the health policy and systems research kind of area, where people study so that they can understand and improve how societies organize themselves in achieving collective health goals and how different actors interact in the policy and implementation process to contribute to policy outcomes. I view us as actors in that. I view us as people that are a part of implementing policy, okay? And how are we doing that, particularly in places that are surrounded by all those complexities that we talked about earlier, okay? So that was something that I thought, I think that's how I'm gonna focus my energy here. I think that's how I'm gonna learn this stuff. And then the occupational therapy professionals on the front line, that's the group that I was concerned about. You know, the people that were coming out of school and my friends out there working hard every day with these stories. The anecdotal reports of practice challenges and ethical tensions, that mattered to me. I don't like it when people have a hard time at work. It's reality in a lot of places, but it doesn't have to be something that you resign yourself to, particularly if it's not the best interest of people that we serve, right? And so I made a decision to think about how could I be a part of a systematic study of role conflict and professional alienation experiences by frontline professionals. Okay? So I had some questions. My first question was wondering if that student was alone in her experience. I didn't think she was, but I didn't want to start assuming, right? So I didn't think so. Is this a student issue? You know, because sometimes it's tempting for us to you know, hang those kind of questions on students or early professionals not feeling confident or not having their voice. So I wondered, you know, was it just about students or was it about practice, okay? What was the experience of occupational therapists and occupational therapy assistants working in practice? I wanted to know that. I also wanted to know how do frontline occupational therapy professionals experience tension and conflict when working to comply with those policies, the organizational policies, while also staying true to the things that are true in their heart, their professional ideals and values. So the big question ultimately was, what is happening on the front lines of policy and practice at the intersection of professional standards and client-centered care? Okay? You guys with me? Yes. Okay, thank you. All righty. One of the things then that I thought about, I appreciate that. You know, we could do audience participation, but I was told 300 index cards would probably not be the best way for us to go tonight. So I spared all of us that bit of an exercise, all right? You know, so role conflict on the front line, and looking at that collision point there, one of the things that I identified as a way to kind of capture this was this notion of policy alienation. I was in a public administration department, okay? Now y'all might be like, why would you be in a public administration department? You're an occupational therapist. And I am indeed an occupational therapist, but if you can't recognize the part where those institutional complexities are loaded, and one of them is sometimes in those public administration kind of areas, you know, management, all those kinds of things, you know, I'm happy to talk to you later. We've got, you know, a lot of things that we can learn from folks in those spaces. But one of the things that I got my head around and wanted to use in my research was this thing called policy alienation, a general cognitive state of psychological disconnection from the policy or program being implemented, okay? So that part where you see a policy and you disconnect from it, like you either disconnect pretty emotionally and just go along with, or you're disconnecting as in, I'm not doing that. You can tell me to do that, but I'm not doing that. That's not going to be something that I find to be useful here, okay? It has some components there of this policy alienation thing, meaninglessness and powerlessness, and you'll see here in that meaninglessness kind of zone, how the professional perceives the value or contribution of the policy to the greater good. You know, if people are seeing this as something that's good, They're going to be more likely to hang on to that. They're not going to run. They're not going to abandon a given policy. The powerlessness part, the degree to which the public, or in our case, the profession, believes they can influence or shape policy development or implementation. Okay? So that too can be an alienation thing. They run, they just disengage, or they stay engaged with the process. And then role conflict is another piece of the policy alienation stuff. I'm sharing this with you because we're going to talk about this and how some of these intersect over the next few minutes. Policy administration then meets occupational therapy. Okay, role conflict, the simultaneous occurrence of 2 or more role expectations such that compliance with one would make compliance with the other more difficult. You have to do 95% today. Does that sit? Does that sit with that other thing, that other role expectation? Maybe that expectation you have of yourself? That expectation that your profession has of you? To provide thoughtful, engaged, patient-centered care, person-centered care? That's what that's about, is posing that question and identifying that conflict, okay? Productivity standards then is the thing that I chose to look at because I think that's one of those policies as such, professional expectation that we have that was getting kind of crossways with role conflict. So productivity standards relating to workload, of course, and progress expectations, and is closely connected to billing practice and reimbursement. These are the things we know, so we know why they're telling us or asking us to do 95% of something. But when you don't have time to spend with people, when you don't have time to really evaluate in a way that's comprehensive, when you don't have time to do the documentation that needs to happen for complete and accurate documentation, then you have problems with that, and you might find yourself in conflict. Sometimes that role conflict is coming from different places. And so we also had a chance, when I was setting up this study, had a chance to think about where that conflict kind of happens. Is it between the policy and the professional? So like when you're faced with policy demands that are incompatible with your professional principles or values, okay? So you have a policy here, the CMS policy perhaps, and you've got your own set of values. There's an intersection there that doesn't line up. That might be where the conflict is. Sometimes there's a problem when you're looking at the policy and the people we serve. The behavior response required of the professional by the policy is inconsistent with the role behaviors expected of the professional by the client, okay? So what do I mean by that? I mean, if your facility or your department is saying you need to execute your duties in this way, but you know that that is not going to be the best support, discharge planning comes to mind. You're not going to be able to do these things in a way that's going to support that client. That could be a problem. That could be a conflict. And then the organizational and professional intersection there. Organizational demands are incongruent with one's professional principles, values, or behaviors. That too is another place where that can happen. Policy professional is different than organizational and professional. A lot of times people will give their organization a lot of room because they're like us. It's us. It's our management, right? Okay, so surely they're doing the best they can, and usually they are. Usually they are, but that doesn't change the part where there still might be conflict. Okay? And so, and kind of in a graphic might look like that. We'll look at a role conflict as it relates to productivity standards. Okay? The other side of that then, I was looking at authentic occupational therapy practice and trying to look at that as a professional alienation kind of thing. There's that policy alienation. I tried to attach that to our profession specifically and advance that definition a bit and talk about that as it related to client-centered care. Okay? So if you think about that professional alienation definition that we had, the professional alienation piece is the extent to which professionals abandon their core philosophical tenets or values tied to their professional identities as a means of managing tension and conflict when responding to policy or organizational demands, okay? Kind of like like my friend Ms. Eisnagel, you know, what happens to us? We made decisions to do something different. We stepped away, okay, as a means of managing tension and conflict when responding to demands, okay? The thing that I was concerned about was client-centered care. Is that what we were stepping away from, okay? Were we alienating our commitment to be client-centered in response to these demands? So, and defining client-centered care, you all know what it is, but I know you can't see anything in the back of the room, so that's why I'm doing what I typically wouldn't do, which is read these to you. Providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all clinical decisions, okay? That seems to be the part where a lot of people say, if I do that, you know, if I do that productivity, I can't be as client-centered as I'd want to be. I can't be as occupation-focused as I would like to be. And I was just wondering why that was. Okay? That alienation is often fed by a sense of powerlessness. Okay? It's not because you don't know another way, you don't have a good idea. It's not because it hasn't come around before and we tried to correct it, but it tends to be this notion of powerlessness, okay? You know, how much can you influence decisions about inclusion of client-centered care in this case, right? How much can you influence decisions concerning the way client-centered care is executed, okay? It's one thing to have it in rules and regulations, it's another thing to actually be able to execute and do it. And then influence of occupational therapy professionals to actually do that in your day-to-day practice. And so that notion of powerlessness, I don't know about you, but you know, you find yourself in those places where you're like, I got nothing. I can't do a thing. I've got no power. I mean, what do you do in those situations? Sometimes you buck up. But sometimes you just say, never mind. And you move on. And then somebody behind you is trying to figure out, how do we do this, right? So we got to continue to figure out this powerlessness thing and how can we be powerful and be a part of solutions, okay? Meaningless, that's another piece of this, the degree to which it connects to our clients and also society as a whole, okay? Now, to get to the stuff that's interesting about it, there's a whole lot there, and you're going to be like, I don't know what the heck she just said, but I want you to know that as we are talking about this, you might think about, you know, is that something that I struggle with too? Is that something that's been a challenge to me? I wanted to look at those things within my practitioners within the state of Kansas. And so we did a big old survey. I say we, when you're doing your dissertation, it's kind of you. There's not a whole lot of we going on there, especially if it's your own thought. But what we did is we drew on the practitioner base in the state of Kansas. So was able to access the addresses, you know, emails from 2259, that's the total that we have in Kansas. The licensed folks there, OTs and OTAs licensed in Kansas were 2173. We sent out an email to everybody. Everybody. That's a lot of people. Okay, we used a Qualtrics type of a survey dissemination strategy, and we used, as you'll see in a second here, a Dillman kind of survey approach for people that care about that kind of stuff. But we had an opportunity to send out, you know, reminders, all those kinds of things, so that we were able to get a solid response rate. Okay, there's always a question about surveys, and as I get more and more junk in my email, I certainly do think about that a lot. But of the 2173, 1,238 of those emails were opened, okay? So that's 57% of those emails. That made me happy. At least they didn't all go to junk. And so that was encouraging. But the part that was really encouraging to me then was out of that 1238, we had 549 actual participants, which is a pretty good response rate if you are thinking about survey land, right? 44% of open surveys were completed. That's pretty good. 25% response rate overall out of that 2173. So, we did all right. I'm sorry, not out of the 2173, out of the 1238 that were opened, okay? So a 25% response rate. 1 out of 4 people cared enough to check boxes for us. That was exciting, okay? And that gave me some information to work with. It was an online survey. We used categories that were in the 2015 AOTA workforce study, so that gave us kind of a frame that I could make sense of and other people could make sense of a bit. We used the policy alienation scales that Lars Tummers had put together and work that he did about that, but we made the changes in that to frame it as professional alienation. It was a Likert scale, it was a Qualtrics dissemination, and we had an opportunity to do a 4-point check to get the best survey results that we could get, or survey participation that we could get. Okay? We used professional profile characteristics, so we looked at credentials, we looked at degrees, we looked at years of experience, we looked at association membership, both nationally and at the state level, employment status, meaning full-time or part-time, primary work function, were people direct or indirect service providers. That makes a difference a lot of times. Work context factors and practice settings, so we looked at practice settings, again in that workforce study. Location is about urban or rural, which are, 2 different, just kind of settings, demographics, if you will, like we talked about earlier. And control and ownership is about, is it a public entity or a private entity, which mattered to my public administration people, so it was there. Role conflict scales, professional alienation scales, and practice preferences, training, organizational expectations, all were part of those surveys. We looked at questions like this, okay? So if you're talking about role conflict possibilities, some examples. Looking at that, policy / professional role conflict thing, a question might have been, looking for my professional values, I embrace productivity standards. Okay? And you got to think about that for a minute, because in and of itself, productivity standards are not a bad thing, right? But then when you start to situate those in places and other things start to happen or other demands come into play, sometimes that can color what those productivity standards actually are used to do. And so it's kind of interesting when you think about questions like that, because people have their own perceptions of what that means, and that's what we were trying to capture. Was there some kind of difference of opinion about that? Or was everybody truly like, productivity standards are the worst? We can't do that, right? The organization and professional conflict, I have the feeling that I sometimes have to choose between my professional values and the way my organization implements productivity standards. Do any of you have that conflict sometimes? Maybe. It might look different. It might have different words. But you might know how you would answer that on a 5-point scale, okay? Policy and client. Working with productivity standards clashes with the wishes of many of my clients and patients. How could that be? If they're wanting to spend more time with you, if they're wanting to have more work on this area or that, an assessment or an intervention, that could be something where there might be a conflict. So those are the kind of questions that we were asking in that way, okay? Professional alienation type questions then, when we were talking about the powerlessness thing. OT professionals have too little power to influence implementation of client-centered care and policy. What do you think? That's something we wanted to know. Tactical powerlessness. The management of my organization should involve the occupational therapy professionals far more in the execution of client-centered care. Maybe they should. Maybe they do. I don't know. Operational powerlessness. I have freedom to decide how to provide client-centered care. Okay, so these are the kind of questions that we were trying to capture in our survey so we could get at the information that we thought would be meaningful. Okay? And then just from an analysis, you know, the analysis questions of things, a cross-sectional design, descriptive, correlative, and then we also looked at some regression kinds of things as well. All righty? So the questions were about our professional profile characteristics and role conflicts in OT professionals associated, our work context factors and role conflict in occupational therapy professionals associated, and then which associated professional profile characteristics and work context factors hold greater influence when estimating the role conflict experience. Okay? So these are things I thought would happen. I thought that we would be having, hold on here. Yep, I thought that we would be having more occupational therapy assistants experiencing role conflict. I thought that our early career people would have a greater experience, more role conflict than our mid and late career folks. The issue there of professional association membership status, I thought that there would perhaps be a lean toward those that were current in their association membership having role conflict. I felt that the part-time and direct service providers would probably, if there was a lean to be had, that they would probably be the people that might have a lean as it relates to role conflict. And then as far as location goes, and keep in mind, this would have been real easy to do a non-directional thing, but that was not allowed in my dissertation approaches, and so this is what we have. And so organizational location, felt like rural might have a greater issue with role conflict just because of the magnitude of all the things that they are having to manage. You know, private over the public, and then long-term care, skilled nursing facilities. I certainly felt like that would be the place where we would see big role conflict, in large part because that's where most of the productivity things were coming from. Okay? So, we were seeing on the role conflict part of it and productivity standards that people had a greater issue when the policy was in conflict with the needs of their clients. If there was a policy that was going awry and it was causing them grief, that seemed to be different, you know, less conflicting than if it was a policy that was making it very difficult to meet the needs of their clients. That was the part that mattered. I want to meet the needs of my clients. Is this policy in the way, and is this the source of conflict? So that was the one that had more. Now you can look at statistics like this, I know I sure do, and say, what's the difference exactly between 3.01 and 2.95? That is a fair conversation that we don't have time to do right now, but just for purposes of what is here, that's what's going on. The other thing that's interesting to me in some of these is they're square in the middle, okay? As far as a mean, that's an average, right? Which always says to me that there's more to the story because you've got a whole lot of people over here and you've got a whole lot of people over here. And when I'm thinking about 549 people, I'm thinking about a lot more conversation and opportunity for a more qualitative follow-up, okay? Overall, when we got through some of the data on that, OTAs experienced more role conflict, which was what we had thought might be the case. Part-time workers experienced more role conflict, and direct providers experienced more role conflict, okay? That tough spot between those things about policies that were being implemented and how that affected their work, okay? As far as work context factors and role conflict, the OT professionals working in long-term care and skilled nursing, they did indeed experience more role conflict. But the other folks over here that are listed, OT professionals working in early intervention, outpatient, and other, single, they just identified one other settings, experienced less role conflict, which I thought was really kind of interesting, just in terms of when you think about context, you have places that are very rule saturated and rule bound. And then you have some places where you have more flexibility. And those in and of themselves maybe don't have those kind of productivity standards. They maybe don't have some of those requirements that put people in a hard conflict spot between this policy and what does the client need that they're serving on that day. So, you know, as you guys are thinking about what are next steps for you as practitioners, maybe that's something you want to think about. Do I want a place that has a rule-bound, rule-saturated environment? Or do I want to be thinking about where are the places where I can work, where I've got some control over my work life? There's an idea. Doesn't happen everywhere, but that might be something that gives you a little something to chew on. Okay? All of these have different degrees of influence on role conflict then. And so I just bring that to your attention before we move on. And that's, you know, pretty much what I was talking about just then. All righty? So I've talked about this. We'll let that go. On the other, as far as looking at professional profile or the role conflict and professional profile characteristics, whoops, sorry. Got that. On the next one, the professional profile and the intersection with professional alienation, tried to look at which associated professional profile characteristics and work context factors hold greater influence there. Hopefully, we've got information for you that will make sense in that regard too. Okay. Again, these were the things that I thought that I would see. And we'll talk about what I did see. Whoops. See if it will go. Okay. So on this one, we have the full scales there, and what we saw here, I mean, the things that were the most problematic for folks were in that area of feeling powerlessness as it related to really their influence in policy, in making policy and being able to speak about policy, all that kind of thing. It was encouraging to me that people felt that they were more empowered in the way that they were able to implement their own client-centered practice, which says to me that some days policy doesn't win the day. Some days you know what's right, or you know what is the way you should go about practice, and you do that, okay? So that was encouraging to me as I worked through some of this stuff. What we found was that OTAs experience more professional alienation again here. Mid and late professional experience more professional alienation, which surprised me. But, you know, for some reason, I thought that, particularly since Julie had come to my office and was saying what happens to us, I really expected that more of the students would be like, you know, what's happening here, and then step away from things. But they were very committed. You know, the young professionals, our early career people were very committed to standing firm in their professional values, their professional beliefs, their professional ethics, even in the face of challenging policy situations. So I found something encouraging about that. What it also told me, though, is that for people that are in their mid-career, late career places, we need to take care of you. We need to take care of each other. We need to be supporting one another and finding out what are the places that are making it hard, what are the places where we can do better, and continue to have people want to stay a part of this occupational therapy profession that they love. Direct providers experience more professional alienation. You know, that's not a hard one, I don't think, to get your head around when you're in the day-to-day, people asking you hard questions, people making demands that are in conflict. Sometimes, if that's where you're at, that is where you step away. And then occupational therapy professionals working in schools experienced more professional alienation, which surprised me. And then OT professionals, occupational therapy professionals working in early intervention experienced less professional alienation, okay? So what that means is that, you know, the people that were working in early intervention environments, they were staying true to their core values, their beliefs, their ethics, those professional expectations. The place where people were struggling were people that were working in school systems and were feeling that they did not have that space to stay committed to what they felt was right and aligning with their professional core values. That one surprised me. I went right to one of my school-based practice colleagues and said, what's up with that? You know, why did it come back like that? What am I missing? And her comment to me, she said, Wendy, she said, that doesn't surprise me in the least. And it's not because she was a jaded person. She just knows the conflict. She knows the struggle and how to continue to be there. She herself had to be in that position where she'd rather be in a classroom working in a full inclusion environment, but has been in classrooms where the only way she was going to be able to work with that kid per that teacher's direction was to take that kid down the hall to the closet. Okay? And that was the part where they felt that they were not aligned with the things that they knew were right, but did not have the space to do. So I felt like that was pretty telling, and not in a great way. Okay, so again, these things influence professional alienation, greater professional alienation, and not so much on the early intervention part of that. Okay? So, I mean, some things on that. The good news, OT professionals are committed to practice that exemplifies professional values and ideals, which is good news. Frontline workers have the closest relationships with clients, but experience more alienation from OT values, from occupational therapy values. So they're in there every day having to do that, yet they're also, butted up with the policy requirements, with the procedures that they have to abide by, and protocols that might indeed be in conflict with what's going on in their professional values and ethics kind of mind. Okay? Occupational therapy professionals might need different supports to incorporate client-centered care and practice across their career. If we have early career professionals that are sound and committed, but we have people that are needing to stay connected to their professional community more closely to get the support that they need, or to ask the hard questions or learn additional skills, we need to think about that gap that we need to fill so that we are not losing people but are supporting people as they move through their occupational therapy practice journey. And then variations in pediatric practice settings equates to variation in degree of professional alienation. That's what I was just talking about. Okay? So the last part of this that I want to chat with you about is about clinician resilience and well-being. And let me just go back for 1 second. This was how I closed it out with people in the public administration department that didn't know what I was talking about. That need that they would have to, that I would be telling people in my world, in my occupational therapy world, that based on what I'd studied, that it was important to understand your conflict, to know your conflict, and to own it. Know where you're having a hard time. Understand where that intersection is. Is it about policy? Is it about management? Is it about you? Is it about your conflict with your, in trying to deliver your best to your client? But to be able to know where that conflict is, understand it, and then also to own your practice. And I don't mean be a private practitioner, I mean be responsible for your own practice decisions. Okay? I mean, you guys have to think about ethics here in this state every time, right? And so when you're walking into a place and you're thinking about what does your practice look like in that day, that's your practice. Wherever you're at, you're the one that's doing it. And so you're making your own decisions about how you will carry that out, about how you come into that place that day, about how you engage in conversations that might be hard with your administrator or with your colleagues. Sometimes it's a person sitting right next to you that is making it challenging for you in that day. Don't work so hard today. You're making me look bad. What? Can't do that, right? Nurture your relationships and commit to personal and professional self-care and resilience. These are things that I would ask that you do. Okay. So to kind of sum some things up here and come around to a place where all things are not gloom and doom, because I don't think they are. And I don't think what I just shared with you was. I just think it's a reality that yes, indeed, there's stuff going on out there. And yes, indeed, we have conflicting places. But the exciting part is that by and large, people still want to be solid, good OTs and OTAs. That's exciting, isn't it? Are you encouraged by that part? Hello, are you encouraged? Okay, just checking. Are you awake? Yes, okay. See, two important questions, encouraged and awake. Okay, thank you. So, I want us to finish up then by talking about the part where because you are committed to your profession, because you are committed in service to other people, because you guys are figuring out what's your next step in your career, or what's your next, population you work with, all those kinds of things. What's life like? What am I doing when I get big? Those kind of questions. One of the things you need to put on the forefront of your decision-making tree is how will I take care of myself while I'm doing these things, okay? Because I don't know about you. We were doing, again, this group of people right here. I was having conversation with them, and we were talking about how long have you been in this profession? You're getting old when that's the conversation, right? That, and as soon as fiber enters a conversation, you're in trouble. So, how long have you been in this profession? How long have you been in this job? It is indeed a marathon, right? Not the sprint kind of thing. So how are you going to sustain yourself? And when there's all this craziness going on, much of which is out of your control, except for the decisions about how you manage that and how you manage yourself, it's important to think about how will you take care of yourself and continue to move forward in this profession, okay? Our board of directors is concerned enough about it, like I said at the beginning, to make this a priority. With all those drivers of change, swirling around, there's going to be things to get our attention. There's going to be things that make us uncertain. That's fine and good. We still have to take care of us if we're in this mix, okay? And so the National Academy of Medicine, they put together an action collaborative on clinician well-being and resilience in the last couple of years in response to the rising suicide rates in schools of medicine and physicians as a discipline, as a profession. And then that, also provided information for other professions, other disciplines that were concerned about the same thing, the psychological well-being of their people. And we have that same concern when we would get calls at AOTA saying, I can't do this. What's going on? This is stressful. I'm burnt out. That compassion fatigue. I'm the little poster child. I need to talk to you. Okay? And so we were concerned about that. We were concerned about that and have started to pay attention. We were paying attention to it 2 years ago, but also then, watching that become a stronger coalition and starting to take some legs in terms of crafting direction to support people, provide suggestions, provide support, identify different kinds of ways to do programs or things like that, so that we are able to have some sound clinician well-being thing going on. Recently, we joined with this network. The network organizations submitted a thing, right? Submitted a statement to become part of the network organizations of the Action Collaborative. And so that just happened in this last month. This is what we said, okay? There's a whole bunch of words up there. Can you read them all? Didn't think so. But this is a statement that is there, okay? It's an excerpt from it. The AOTA recognizes the need for occupational therapy practitioners and students to invest in strategies to combat burnout and stress. Okay? Current healthcare practice requires occupational therapy practitioners to manage many dimensions of patient care, combining professional and educational duties with the emotional energy required for patient encounters, and managing one's personal life can create the potential for burnout and compassion fatigue and an imbalanced professional quality of life. We don't want that. So we want to be a part of being able to support our professional community, being able to look at each other as sources of encouragement, as places that we can check in with somebody, to know that, that part where I'm wondering, is it me? No, it's not me. That's good to hear, right? I'm glad somebody's in this boat with me, right? So we've sent this off. It's in a whole statement. It's supposed to be posted to their website within the next few weeks. Okay? We do know this is happening. One of my favorite conversations, that was not my favorite conversation, was the one where someone said, do we have any evidence that people are burnt out? What? I don't even understand how that could come out of somebody's mouth, but it did. Do we have any evidence? In the spirit of evidence-based practice, I'm going to assume that's where they were going, except for the part where I was like, I don't know what to do with that question, and I'm not sure I know what to do with you at this minute, but okay. But it meant maybe we need to do a little bit of a search so that we could see what's out there. There's not been a lot done on our own stuff. There's been some, but certainly there's a lot more, like in the nursing literature, the medicines literature, that kind of thing. But a couple things I'll bring up right now became part of that follow-up conversation. Okay, one of them had to do with moral distress and resilience in the occupational therapy workplace. Okay, this was coming out of a magazine called a journal called Safety, and was looking at these factors within the context of what? Safety? Yes. Okay, but it really was looking at what were the top 10 situations that were reported to cause moral distress. Okay, so they have to do with, number one, being expected to treat and or write documentation for more clients than time allows. That would cause moral distress. Yes? Watch the quality of client care suffer due to lack of follow-through with recommendations from therapy. That was the number 2 item. Now, keep in mind, this is one study, so we can hash this 1,000 ways to Sunday, but it's what we have to think about for the moment. Work with healthcare team members who demonstrate insensitivity toward clients, families, or staff. Does that cause you moral distress? Expected to follow unrealistic directives from the administration that impacts the quality of care. That might be an issue. Witness diminished quality of care due to poor team communication. That's frustrating. That's distressing. When you can't get it together, you can't get on the same page, and who suffers? The people we serve. That's a problem. Required to care for clients I don't feel qualified to care for or have not received the required advanced training to provide those services. Okay? Being put in a position to compromise your ethics. That's what that's about. Somebody asking you to do something that you are not prepared to do. And yet you don't feel that you have the room to say no. That's tough, right? Work with team members or healthcare providers who are not as competent or experienced as patient care requires. Carry out physician's orders for what I consider to be unnecessary evaluations or treatments. So that time when you're ready to discharge someone and they say, not today, how does that sit with you? Right? How do you respond to that? Carry out, or I said that, right? Unable to provide optimal therapy services to clients due to limited insurance coverage or insurance cutoffs. Definitely a thing. That's distressing. And then provide services that do not fall within my scope of practice due to staff shortages in other areas or disciplines. I mean, unfortunately, some of these might sound familiar to some of you. And indeed, those are the things that when you go home at night, you're distressed. You're not sitting well with how the day ended, okay? So that's what's going on with this. So that was one where I was like, I think we've got something to talk about here. We've got a little evidence. And then the part here about ethical tensions, okay? And this ethical tensions in occupational therapy practice, this was a scoping review, so had a, a more broad overview of the literature out there. Tried to pull that together. This was in the British Journal of Occupational Therapy, okay? And the place where those tensions are big, resource and systems issues, okay? So that's things like insufficient staff, excessive caseloads, lack of resources. Those are things that, prompt that tension, okay? Tension between acting for the client and being perceived as delaying discharge, upholding ethical principles and values as it relates to discharge planning, when that's like in contrast to what's being asked of you. Practice management is another place where ethical tensions can run high, related to professional boundaries, caseload, dual roles, documentation, professional accountability, all those kinds of things. Client safety, that's a given. If you're in a situation where safety is being compromised, that would not feel right to me. But that's something that came up in this scoping review, okay? Interpersonal conflicts. Tensions and conflicts may be generated when the clinical opinions of therapists are not respected. That could leave you not feeling so hot at the end of the day. And then upholding professional standards such as implementing what? Client-centered practice, evidence-based practice, competency of occupational therapists and occupational therapy assistants, I would add to that, and failure to speak up were identified in the literature, okay? So that place where those things are not allowed, that becomes a point of ethical tension, okay? So when someone asks, do we have any evidence? We started there, we're building on that. Maybe you want to be the next study. That'd be an idea, right? Okay. And then the last part of this has to do with students. Okay, there's a lot of you in this room. Not that the other two didn't apply, right? Moral distress, ethical tensions, pay attention. But this is about you. Student distress is considered as a specific public health issue, as research has shown increased levels of anxiety, depression, and risk behaviors in the student population. Okay? That's hard. Students report high levels of daily hassles, workload, lack of meaning, manageability, and understanding throughout their university years. Now, think about that. I mean, if that's you, and burnout is a thing, make sure that you too are thinking about how do you sustain yourself? What are your resources? Who are you contacting to talk through these things, to get the support that you need, so that you're able to identify your sustainability plan. You're not even there yet. We can't have you bailing before you even get out the door now, can we? That's not a good plan. Some of you are ready for field work. May's happening. You're getting ready to graduate. That's a big deal. That's a big day, right? But I want you to be excited the next day too. And the day after that. And when you get out on your clinicals and these things that we're talking about seem magnified, okay, remember to reach out. Remember to think about what are the ways that you can get support from your professional community. Look around this room. This is your professional community. There's a lot of people that are not in this room that are still your professional community, right? That's who you need. Don't lose sight of the folks that are right there next to you, okay? Just an additional part of that support, it just played out what this looks like here. I'm not gonna go down each and every one of those, thank you very much. But gave a long list of things that people could check, the students could check and see what applied to them. You might see yourself there, okay? I do find it interesting that finances is the very last one. Okay? I know student debt is an issue. It seems to me that there might be other things up there that are causing some distress for folks in our student population. Okay? Okay. So, professional resilience is what I'm going to ask of you. We can define professional resilience like this: a health and human service professional's commitment to achieve balance, yes, amid occupational stressors and life challenges, while fostering professional values and career sustainability. Okay? A commitment to achieve balance amid the tough stuff. The things that we know, remember at the front end I talked about what we knew and what we didn't know, what were kind of our knowns and unknowns? They're still there. And whatever is the known and unknown, like right now, in 5 years there'll be a whole other set, or there might be the same set for that matter, of knowns and unknowns. They just have a different flavor, okay? But we still need you to be committed to caring for you as you care for others as part of this profession, okay? So, your commitment to achieve balance amid occupational stressors and life challenges while fostering professional values and career sustainability. Can you do that? Need a little pledge thing. That's what I need the index cards for. Psh, what was I thinking? That's what I needed you to be signing up for, okay? And in case you're uncertain, there are some things that you can do, right? So how about this? What are you doing for your physical and psychological self-care? Who are the runners? Who are the yogaers? I saw you, yeah. Who are yoga people, right? Who are my listen to music people? That'd be me, right? I mean, what are the things that you're doing to get your head in check? What are the things you're doing to take care of your physical and psychological needs? All right? Another one, identify and tune in, check in with that foundation of inner strength that you might have, whatever that is. For some people, it's a spiritual thing. For some people, it's a nature thing. For some people, it's things that I'm not sure. But what's your inner strength? What is that place where you go when it's like, wow, there's got to be something bigger than me? Something that's going to get me to the next day? What is that? Okay? You need to figure that one out, perhaps. Personal and professional value. I mean, you can talk about values if you want, but I also want you to think about what is your personal and professional value? Because when you're able to identify in yourself your value, you're not going to have a question when somebody's challenging what you bring to a conversation. You're not going to have a question when somebody's wondering, why are you still here? Because you're going to have an answer. It's because you need me here. It's because I know this about this policy and I'm here to educate. I'm here to help. It's because this population of people matters to me and I'm not going anywhere. So how are we going to work on this together? And the value that you bring to that is information, it's passion, it's commitment. And in some places, it's a bottom line because you're an occupational therapist and they can get reimbursement for this and they need you there too. There's a whole lot of things, okay? Professional goals and aspirations. I don't know about you, but don't you wake up in the morning and you're thankful if you've got something to do? I mean, when you hit that place where you've checked all your goals, first of all, don't you have goals? You got goals, right? You got aspirations. That's what gets you to the next day. Sometimes it gets you to the next hour, but it's there, okay? And it's your commitment to do those things. That's a commitment with you, right? That's going to keep you moving forward. And then that last piece there, belief in self-advocacy. I say this all the time because I believe it's true, you have got to advocate for you. I mean, if somebody's telling you that you're going to do 95% productivity kinds of things, and that's a crazy thing that's going to send you home at the end of the day saying, what just happened? And oh, by the way, I feel really bad about the care I provided for people. You need to advocate for yourself as an individual, as a professional, and as a part of this professional community to say these are things that we need to have a conversation about because this is not okay. Okay? So that's a hard lift. It's a heavy lift, right? But it is about identifying what are you standing for, what are you not standing for, okay? And how are you making clear what you need in those places, all righty? We talk about the people we serve. We want to teach them how to advocate for themselves. At what part did we all of a sudden forget that we need to advocate for us? Okay? We do. And so you need to use your voice, identify what it is that we need to move forward, okay? So, kind of to close this then, I hope that you heard some things about where we're at. You know, some of those knowns and unknowns, because you have to acknowledge those things. I hope that you also heard that we may be in conflicting situations sometimes, we may be in conflicting conversations, we may be the ones conflicted, okay? But the part where we're committed to our profession, to our professional values and ethics, that can take us to the next day, right? All fall, the keynote that I did was called Rise Above, New Day, New Way. All righty? And sometimes that's what you've got to do. You've got to wake up. It's a new day. That thing yesterday, I can deal with that. There's a new way. And it's going to start right now. And it's going to start with you, right? So I ask you to think about the ways that you can be part of moving our profession forward in that way. Do it taking care of you. Do it taking care of me, right? Do it taking care of us. And we will be in good stead here over time. Last, I just remind you, when I did my presidential address, the last thing I said to folks was that I had a wish for them, I had a challenge, a dare, and a hope, okay? And my challenge was that you be hopeful. You know, I challenge you to be hopeful. When those things get tricky, when they get tough, there's no reason to not look with positive anticipation to the next day, okay? That's what will take you there, first of all, okay? But it's that nexting, that what's next, that's going to help you with that perspective, that's going to help you understand that you will be able to be a difference tomorrow, that you will be able to feel in a better place tomorrow. I mean, this is your conversation with you, right? And that commitment to be hopeful. I said too, I'm going to dare you. I'm going to dare you to be optimistic. You know, it's a rebellious thing to be optimistic. There's a lot of people out there would just as soon be negative Nellies, and if there's anyone named Nellie in here, it's not personal. But it's very easy to be pessimistic or to get in that negative zone, which does add to a kind of a tough work environment when you think about that pretty much supports some of the difficulties we've been talking about as well, right? So I want to ask you, I want to dare you to be optimistic as well. Be brave. Be the one that says, I don't think it is all that bad. People are going to look at you like, what? But they might ask a question. You might have an opportunity to partner with people and then think about how can we move forward in a positive way. And the last thing that I asked people to do was to be able to identify the things that bring you joy in your life. Okay? It's a short life, people. Whether it's 8 days, whether it's 80 years, you never get done what you want to do. And so do it in a way where you have joy in your day, joy in the people that you choose to spend your time with, and by all means, find joy in your profession, okay? All righty, thank you.
UFTV is your university and community TV station.